Hi, my name is Corina Fierro and I'm going to talk about therapy for the prevention of metachronous gastric cancer. Definition. Gastric cancer is a relevant pathology, is of high incidence and high mortality. The World Health Organization classified Helicobacter pylori as a group 1 carcinogen for gastric cancer. Patients with early gastric cancer who are limited to the gastric mucosa or submucosa usually have advanced loss of glandular mucosa tissue, glandular atrophy, and are at high risk for further metachronic development of new gastric neoplans.
Helicobacter pylori is a widespread bacterial pathogen and major cause of gastric cancer. However, it's not known whether patients with early gastric cancer who are undergoing endoscopic tumor resection would benefit from H. pylori eradication in an effort to prevent subsequent gastric cancers. In a double-blind randomized controlled study conducted at South Korea's National Cancer Center, 396 patients with early gastric cancer or high-grade adenoma who were undergoing endoscopic tumor resection were randomized to receive H. pylori eradication therapy or placebo. During a median follow-up of 5.9 years, subsequent gastric cancer was identified in 27 of 202 patients in the placebo group, but in only 14 of 194 in the H. pylori treatment group, approximately one-half the rate. Patients with successfully eradicated H. pylori had approximately one-third the rate of subsequent gastric cancer. In addition, histologic analysis of precancerous gastric mucosal atrophy at baseline and 3-year follow-up showed atrophy grade improvement in 48.4% of the H. pylori treatment group as compared with 15.0% of the placebo group. No serious adverse events were documented. The authors conclude that even in patients with gastric cancer with severe histologic changes, H. pylori treatment significantly improved gastric mucosal atrophy and reduced subsequent gastric cancer development. Full trial results are available at nejm.org.
Application in medicine. In this prospective, double-blind, placebo-controlled randomized trial, we assigned 470 patients who had undergone endoscopic resection of early gastric cancer or high-grade adenoma to receive either Helicobacter pylori eradication therapy with antibiotics or placebo. Two primary outcomes were the incidence of metachronous gastric cancer detected on endoscopy performed at the 1-year follow-up or later, and improvement from baseline in the grade of glandular atrophy in the gastric corpus lizard curvature at the 3-year follow-up.
Hey everybody, this is Dave Humpes from hpylorisymptoms.com, and just a very short video, probably only 2-3 minutes, just to ease your mind, or just to discuss very quickly the relationship between H. pylori or Helicobacter pylori infection and stomach cancer. Now, in 2005, two doctors from Australia, Dr. Marshall and Dr. Warren, they were awarded the Nobel Prize in Physiology and Medicine for proving that H. pylori causes stomach ulcers. So they proved that this was the case. The theory had been out there for many years, a couple of decades in fact, but Marshall and Warren proved that H. pylori causes ulcers. Okay. Since then, there's been quite a lot of research done on the relationship between H. pylori and possibly stomach cancer. And I get asked a lot via email, will I get cancer if I have H. pylori? And the answer is not that simple, because number one, there are different strains of H. pylori, so each individual H. pylori bug does not necessarily have the same impact on you, and number two, you're different from everybody else on the planet. You know, you're a unique individual, there's nobody like you in the universe. So the fact that there are different H. pylori organisms and there are many different versions of you and I basically means that the relationship is complex. Now, some people may develop stomach cancer from H. pylori, but the vast majority of people probably won't. So if you're worried about this, then the real answer is that, you know, H. pylori may cause stomach cancer. There's not even a 100% definite cause-effect relationship yet, but what they have found is that some people with certain types of stomach cancer, when H. pylori is removed, the cancer goes away, okay? So it's very, very important for you to take it seriously that some of these more serious issues can happen, and therefore if you have symptoms such as heartburn, reflux, constipation, bloating, digestive pain, etc., and you know you have H. pylori, or you want to find out what's causing those problems, that you take steps appropriately to either get rid of the H. pylori or find out what is causing the problem, okay? So don't be too concerned, because a very small amount of people are likely to develop serious illnesses like stomach cancer, okay? But it's not worth the risk, so I highly recommend seeking either more medical counsel, or you can go to my hpylorisymptoms.com website, where there is a ton of information on there about H. pylori and the experiences I've had in working with, you know, hundreds, you know, thousands now of people who have that particular bug. So my name's Dave Hompez. I hope this has been useful to you, and I'll hopefully see you at hpylorisymptoms.com.
Pros and cons. Meta-analysis of population studies have shown that with the Helicobacter pylori eradication therapy, a decrease in the incidence of gastric cancer is achieved by up to 34%. Patients with advanced premalignant gastric lesion, such as intestinal metaplasia, didn't decrease their cancer incidence. Patients with endoscopically treated early gastric cancer have a high risk of metachronic cancer, in some cases serious up to 3 per year. The incidence of metachronic cancer was close to 50% lower in those who received treatment for eradication. Metachronic cancer that are detected in the placebo group require surgery more often.
I'm Dr. Nanda Rajneesh. I practice in Apollo Spectra and Motherhood Hospitals. I practice laparoscopic surgery and oncosurgery. In the presence of H. pylori infection, patients will have lots of problems with chemotherapy also, because as such chemotherapy is known to kill the superficial cells and fast growing cells in the body, including intestinal cells. If there is also associated H. pylori infection, then the gut is going to get ulcerated with increased acid secretion at the time of chemotherapy. So while taking chemotherapy, if you are taking treatment for H. pylori infection, then it is good for you if it is confirmed that there is an infection.
Issues applied in Ecuador. This therapy has not been done previously in Ecuador. Conclusion. Eradication of Helicobacter pylori in patients with early gastric cancer undergoing endoscopic resection is an effective measure in significantly reducing the incidence of metachronic cancer and is associated with a decrease in the degree of atrophy.
Bloating, pain, nausea, and fullness all are symptoms of stomach dyspepsia and ulcers. For years, people thought these issues were sometimes caused by stress, but the truth is they're generally caused by common bacteria. And doctors at Mayo Clinic say if you have it, and 1 out of 5 people do, you should likely get it treated.
Yeah, March is kind of a hectic time. Here we go. If you win the game, you move on. If you don't, wait for it, you lose and you're done.
Kirk Thompson thought maybe his stomach problems are caused by the stress of coaching.
I must be a glutton for punishment because it gives me a lot of headaches, a lot of stress. Coaching is stressful, but I do really enjoy working with the kids.
It turns out that Kirk's symptoms, bloating, pain, and nausea, were really caused by a bacteria called H. pylori.
It's a bacteria that you actually acquire as a child. And once you acquire the bacteria, it lives with you until you pass away. It's a lifelong companion.
But Dr. Nicholas Talley says treatment with antibiotics and other medications can be effective for 4 out of 5 people who have the bacteria. You see, H. pylori causes inflammation in the stomach. The inflammation can then cause ulcers, which could lead to bleeding, and this increases your risk of stomach cancer. A small risk, but a real one.
If you get symptoms that might be like an ulcer, stomach pain related to meals, feeling uncomfortable after meals, it might be worth having it checked out whether you have this infection. If you do, it is worth having it removed, the infection removed, with treatment.
And after treatment, Kirk's symptoms aren't completely gone, but they're a lot better, and he can worry about his team instead of his stomach.
I know the medication has really helped.
Now, there is one drawback of getting treated for H. pylori, and that is some people may experience heartburn afterwards. If so, talk to your healthcare provider about getting treatment for that symptom. For Medical Edge, I'm Vivian Williams.
Thank you.